Across the country, it's estimated that more than 653,000 people are homeless. In major cities like Las Vegas, Los Angeles, and Austin, Texas, Black people are more likely to become homeless and face extraordinary difficulty getting out of that situation. Black people make up 13.7% of the overall US population, yet a staggering 32.2% of the country's homeless population is Black, according to national statistics. Homelessness experts say the problem is twofold. Circumstances like poverty or joblessness or incarceration are more likely to land Black people into homelessness in the first place. Then it's harder for them to qualify for taxpayer-subsidized housing.
As with every system in America, right, there is embedded racism. But it is true that the homelessness response system, like every other system in this country, has embedded racist functions.
One key reason it's so difficult to get this housing is tied to the questionnaire used to rank the perceived vulnerability of homeless people waiting for housing. Questions like, how many times have you used the emergency room? Have you ever engaged in risky behavior like prostitution, sold drugs? The higher a person scores, the higher they move up on the list. But experts say that while these questions can help gauge how likely a person is to get sick and die while homeless, they're less relevant for housing. And such surveys actually favor white people.
There's a lot in how the vulnerability instruments were constructed. The first being that they were normed on a majority white, a majority older population, principally in Boston. And so right away, we see that the concerns that the assessments drive themselves towards are concerns of that population. And there are pretty significant differences.
Research shows that white people are more likely to score higher on these vulnerability assessments and therefore be placed at the top of the queue for available housing. Experts say they tend to score higher because they tend to be sicker, have higher health insurance rates, and are more trusting of the healthcare system. Black people, meanwhile, are more likely to be homeless due to economic hardship tied to being jobless, for example, or having an eviction or prior incarceration. And in response, some communities are now coming up with new questionnaires known as vulnerability assessments in hopes of reducing racial bias in housing. Los Angeles County, for example, is planning to assign more points toward housing for drug use and having HIV, which affects Black men more than any other group. New HIV diagnoses were 8 times higher for Black adults as for white people. In Travis County, Texas, home to Austin and surrounding communities, people who previously lived in gentrified neighborhoods may now move higher on the housing waiting list. It's a county where a Black resident is 6 times as likely to fall into homelessness as a white person. And in Las Vegas, homeless people now score higher if they've been arrested or served time in prison or jail.
We were creating this list to nowhere. This list of 6,000 people that expected housing because that was the common perception that if I get an assessment done, I'll be on a list for housing.
To read our coverage and learn more about the housing waiting list and how it affects Black people, go to kffhealthnews.org.